you refer a patient to a surgeon? You don't do that yourself?
Some dermatologists do facelifts. I prefer to send them to a facial plastic surgeon.
So then you have your referrals.
Exactly, exactly. I say if there's somebody who can do something better than me, I'm going to send you to them. Treat you as if you were my mom. So yeah.
Full circle back to mom. Doctor, are you finding that men are coming into your office more?
Absolutely. Absolutely.
Because again, I would never admit to anything, but please leave a card on the table. Why do you think that is? Because it used to be such a female exciting thing for women to go in to get the Botox, to get the Juvederm and all this. Why do you think men are doing it more?
Well, I think, you know, it's never a secret. Men do care about how they look. And I think with such a wide variety of options on the table, you know, where you can go into an office and come out that day and not look like you've had anything done. You know, you're not in bandages. You have a couple bruises and a couple injections that you can cover. That makes it an attractive option for guys too. So they can easily go back to work. They've had their Botox. They prevent their wrinkles. They've had their filler. They can look more full, more healthy, more refreshed, without looking like they went to get surgery. And the stigmata of having facelifts and doing a lot of cosmetic procedures for men has been lifted. So men are actually coming in quite a bit to get a lot of these procedures.
Thank God.
I think something that people are afraid of, though, is altering your looks or getting that sort of that tight. I think of the woman in Brazil, you know, who had
Catherine Hellman.
Catherine Hellman, her
was on
character
soap.
with the face drawn back. Nobody really wants that kind of look, and I imagine that cosmetic surgery has advanced to the point where the results are a bit more predictable. But how do you avoid someone coming out of whatever procedure looking a little freakish?
Jocelyn Wildenstein, the cat lady out of New York, there was a woman that was so obsessed with getting plastic surgery done to impress her husband. She's now known as the cat lady.
Well,
Because she looks like a feline?
It's staggeringly shocking as to how, and she keeps on going into getting surgeries done. I mean, don't you find the opposite of that?
That's unnatural.
It's turning into like an obsession. Look at Heidi Montag from the Hills that just had 10 procedures because she wanted to look more beautiful, and she was a beautiful young lady before that.
Well, too much of anything is bad. So, especially when you're talking about surgical procedures and doing multiple...
Because you can't go back.
Once you do multiple facelifts, I mean, you're going to have that stretched appearance. I mean, the purpose of a facelift is to stretch your skin back. So if you do multiple facelifts, plus the scarring that results with every procedure, you are going to get an artificial tightening that won't look natural. Fortunately, in my field, you know, doing just cosmetic derms with fillers and Botox and lasers, I don't run into that so much. But the facial plastic surgeons, they have to know when to say when you have that patient who comes in and wants a little bit too much done.
Mm-hmm. Or they have these weird lips. What is with the weird lips? Every model in Vogue magazine that I get has these lips that look like, I don't know, they look like couch pillows.
I've been in Vogue. You know, when we come back in our wrap-up, we're going to laser some skin disorders, and Dr. Mehrabi is going to give us preventions and answers to them. Don't go away. Stay with us.
Welcome back to HEALTHline, and we are talking about the skin, warts and all. And speaking of warts, our guest, Dr. Don Mehrabi, is about to be subjected to our rapid fires. Name the skin disorder. We name the skin disorder, and he names the symptoms and if they know how it's what its cause is and what the treatments are. So, you want to start?
Warts. Go.
Okay, warts are caused by the human papillomavirus. Many different types of human papillomavirus.
Over 50.
Over 50. It can occur on the hands, the feet, and other areas. And
the genitalia.
That's correct. And as far as treatments, many different treatments. You have lasers, you have topical medicines that you can put on, and we also tend to freeze warts. That tends to be the most common treatment.
There's also an injection women can get as well.
There's a couple different injections. There's Candida injections, and then there's bleomycin injections, which actually is a chemotherapy drug and works very, very well.
What about lichen planus?
Lichen planus, it's an inflammatory condition, can affect the hair, the skin, the nails, can also occur in the mouth. Generally presents on the ankles and on the wrists with these purple bumps with a little whitish scale to them. Tend to be very itchy. We don't have a cause for them, but sometimes associated with hepatitis C. And as far as treatments, topical steroid creams, injections, steroid injections, as well as some oral therapies.
Skin tags.
Skin tags tend to occur because of genetics, so if your mother or father had them, or weight gain.
What is a skin tag?
Skin tags are those little brown, essentially protrusions that you get around your neck or in your armpits or in your groin.
Oh.
And they tend to get snagged on necklaces. There's no cause except for genetic and weight gain.
And put down the donut.
And what do you do to them? Can they be removed?
Actually, you can pretty much cut them off, even at home. And you cut them
Let's have
off.
a skin tag cutting party.
That's the easiest and quickest treatment.
What about fungal infections? That must cover a fairly broad range, but what are some of the ones that you most commonly see?
Well, the cause of fungal infections obviously are, in most cases, dermatophyte infections. It's 3 specific skin fungi that we talk about. That's your cause of athlete's foot, jock itch, ringworm. You can see it in any age. You can see it in any person.
Predominantly male or female as well.
You can see them in both.
Interesting.
And specifically, people who have cats or dogs at home. They tend to get it at a higher frequency.
So it's an external element working on the surface of the skin as opposed to coming from within?
Absolutely, yes.
And treatment, doctor?
Treatment, topical creams, and then we have oral medicines such as Lamisil or itraconazole.
Stretch marks.
Stretch marks.
And it's not a disorder, because I know it's people gaining weight. How do people take care of stretch marks?
Okay, well, stretch marks are obviously caused by stretching the skin or growth spurts. Pregnancy. Anything that stretches the skin rapidly. So pregnancy, growth spurts. As far as taking care of stretch marks, $100 million question. There's nothing to really prevent stretch marks. People ask me if cocoa butter, shea butter helps. Nothing to prevent. To treat, the new way of treating stretch marks is primarily through lasers. And reasonably, you can only expect about a 30 to 40% improvement. There are specific lasers that can help you with the color of stretch marks if you have the purple ones. But if you have the white ones, you can use lasers to maybe get 30 or 40% better. But the golden treatment, there hasn't been one yet. And if somebody finds out what it is, they're going to be retired in 2 weeks.
Back to infections. What about MRSA and the dreaded flesh-eating bacteria?
Well, flesh-eating bacteria is a type of strep, and definitely not common, and it's primarily seen in emergency rooms. MRSA is becoming more and more common.
That's MRSA.
That's right. That's methicillin-resistant Staphylococcus aureus. Most of the staph infections in the community used to be sensitive to the antibiotics. This one is very drug-resistant to a certain class of antibiotics, and that's becoming more common. It used to be in the hospitals only, but it's becoming more common in the community and tends to cause very painful, long-lasting infections that can be a challenge for a lot of doctors.
Last one, hives.
Hives tend to be an allergic reaction. 70% of the time you're not going to find a cause. And out of the remaining 30% of the time, a viral infection is the most common cause of it. So if you get a cold, you can get hives right after. The treatment for hives tend to be an antihistamine. You can do Benadryl. You can even do Claritin, Zyrtec. There are other newer medications that can work really, really well for chronic hives. But locating the preventing factor, if possible, is a primary treatment.
Our guest, Dr. Don Mehrabi, has a very interesting website, bhskin.com. That's Beverly Hills Skin, bhskin.com, because one of his 3 offices is in Beverly Hills, the other being in Tarzana, and right here in little old Glendale. Thank you so much. This has been so interesting, and really appreciate your time and answering all of our questions about skin.
Will you come back?
I will, absolutely. Thank you for having me.
It was a pleasure, doctor. Remember, if you don't pay attention to your body, who will? I, along with Suzanne Wally, want to thank you for spending this hour with us and talking about your skin, because as you learn, skin is more than just skin deep. Remember, if you don't have your health, you don't have anything. Have a great night.
Good night.